Hey, Chris, how's it going this morning?
Going great. How about yourself, Ron?
Doing great. Today's a really fun one. We're going to
Awesome.
move over into the HIPAA space, and we're going to talk about a really interesting one that we've done quite a few projects on, and that is how to use a prescriber provider portal like our Clarity portal to expand your network, right? We've got a lot of clients that come to us that are manufacturing either compounding medications or, they're serving for, we've had a whole bunch of them that are competitors with like for hymns and stuff lately, right? They treat hair loss and
Mhm.
ED and things like that. But the problem is that with the addition of telehealth, theoretically they could service the entire US, but they don't have doctors in their network in those other areas. But our portal allows them to expand their provider network. So that's what we're going to talk about today. So I'm actually going to kick it off and hand it over to you and let you talk about what is the provider, what is a prescriber portal, and how do we use it to expand a network, right? I've given the business need. Now you kind of give us the solution, and then we can kind of tear it apart and talk about the different aspects of, signatures and prescriptions and integrations and all that kind of fun stuff.
Yeah, absolutely. I think this is a really key opportunity to essentially deliver more value at scale within the overall medical arena. And there are a lot of facets of this. You cited a couple of niches with hair loss and ED, but as really any sort of commoditization within a space occurs, or even really any sort of democratization of access to some of these really specific services and just overall care that can occur in addition to prescriptions. It's going to essentially revolutionize some of these specific areas of care within the industry. So the problem that generally happens is one of the sort of classic situations is a caregiver or a provider. They're only going to be able to physically provide this support in a certain region that's geographically, restricted effectively, not literally, but effectively. And of course, there are also jurisdictions with different state rules and state lines that can also come into play. So a lot of our clients come to us looking for a solution where they can basically facilitate working with, pharmacies, pharmacists, providers that can actually go through a telehealth session. They could go through chat, video, telephone only, or a combination of all of those, and basically enable the ability to get access to really an expanded network that's easy to ramp up into the network of providers. In a lot of cases, the providers that are starting a business, they're going to be really focusing on a specific aspect of the market, but they're not going to necessarily be focusing on physically expanding everything. They're focusing on that area of medicine. And so, what we want to do with our platform typically is help you to expand the physical network and essentially create a system whereby you can expand your footprint and expand your ability to provide service and support to the end user. So once you get enough folks going through your system, going through, maybe there's a solution that you've come up with for, some kind of skin issue. Maybe people have psoriasis issues, and you have creams and ointments that will help fix that, or at least alleviate some of the pain. And so a lot of times what we see is clients will get to a certain point of success, sort of manually scaling things up. And what we want to do is bring them systems and processes with a very turnkey solution that's going to give you the ability to scale and take what's working with a few individuals and scale that out. And make it really attractive for providers who may not be directly involved in your business to plug in and ramp up and be able to provide care and service for your end customers as though they're part of your organization. So I don't want to go too much into the weeds, but that's the general idea, is to be able to expand your footprint and your service without really, reducing any of the level of care or processes that you figured out that work really well.
Yeah. I like that introduction. So before we go too deep into some of the features that the portal can handle, one of the things I want to cover is I had a couple calls literally last week where they were asking me how to expand their network. And there's two basic ways that I've seen over the last 6 months that I've seen my clients that were building these provider portals for expand their network. One is more expensive than the other, but one is obviously faster and more painless than the other, right? I mean, you get what you pay for. One, there are a handful of providers out there, and I'm happy to provide them to you. I won't put them on blast today on the call, but if you want to schedule an appointment on our website, come meet with me. I'm happy to make introductions to those companies. But there are a number of companies out there that actually sell, and you can purchase their services, and they actually have gone out and built a network with doctors that cover all 50 states. So all you have to do is just sign up with them, and then we integrate our portal to their system, and then it automatically provides us access to coverage in all 50 states. That's the fastest. It's the most expensive. It's usually a little cumbersome because that company is trying to charge you more and provide extra value. So they're trying to have their own portal. So now all of a sudden you have portions of their portal, portions of our portal. It's kind of fun to deal with. The other way that most of my clients are doing it, they either want to bootstrap it or they want to make it more profitable for themselves. So this is how I recommend being an SEO person, right? I live SEO. That's easy for me. So let's say, for example, like Chris just said, maybe it's a skin cream for psoriasis or eczema or something that you guys compound, and you want to have dermatologists in all 50 states be able to prescribe your medication. So people could go online, somebody could Google best skincare for eczema. You guys have done some SEO work. We show up at the top. They want to be able to buy from your website, but you can't ship it because it's a prescription strength and you need coverage in every state in order to get it approved before you can ship to that state. So basically what I do as an SEO is research, right? I'm doing keyword research. So all you're doing is keyword research. So you literally go out and let's say we're going to start top left corner of Washington State. So I go in and I Google Washington State dermatologist, or Washington State best dermatologist, or Washington State telehealth dermatology, whatever I want to, I can go search and I'm going to find 50 dermatologists up in Washington that do telehealth. And I just pick up the phone and I call them and say, hey, we're a manufacturer of, and then you give them your pitch. We need coverage up there. How much do you guys typically charge for a telehealth session? And they can say whatever it is, $129, $89, whatever it is. You can say, great, you're going to sell your medication. So you're making sales. And then you can say, we're going to bring you new patients and we're only going to take 10%. We're literally going to pass 90% or whatever percentage you want to you. We're going to provide an access portal. You'll just be sitting there and you'll all of a sudden get these emails that says, hey, there's prescription waiting. You can go in, you can review it. If the patient needs a telehealth session, you can additionally charge for a telehealth session. And then you can approve the medication. We'll go ahead and ship the medication to their house and they will be your patient. So we're going to bring you patients that you can have ongoing care. And we will take a small cut and sell their all we ask is that, this is for us bringing you leads to sell our medication because clients are already interested in our medication. So those are two quick ways that you can build your provider network, one on the cheap and one on the quick, probably the best way to look at that. So Chris, do you want to go ahead and dive in a little bit and talk about, let's say, and we can showcase a couple of the ones that we've done recently. Skincare happens to be one of them that we've done, right? Foot care is one, but we've got a whole bunch of them. We can talk about, matter of fact, let's talk about GEM and we'll walk through that scenario, right? Mm-hmm. So this is a portal that we've done this for where they treat IBS. They only have 2 different medications. I'll pop a screenshot right here so you guys can see the medications and their website's live. It's in production and clients can go in and order. They can see the 2 different types of tests that are offered for IBS and they can order the tests. Now, the way we built this portal, and Chris, I want you to talk about some of the technical way that it facilitates, the ICD codes and the digital signature and some of those other things, right? but it's got two different checkout mechanisms. One checkout mechanism, if Ron, the patient, goes to that site and says, I've got IBS, I'm searching for the best medication, I've seen the TV commercials on this one, I want this one, and it walks me through a 5-step process, and I'll throw a screenshot up right here, and you can see it's kind of a nice little wizard that walks you through the process. It's got items for me to sign consent and do HIPAA and things like that. And that there's another one when I go in and I sign up for this and it gets forwarded over to Dr. Chris, and Chris has to go in and Chris can then prescribe it. Now, Chris has two different ways that he can prescribe it, and I'll put a screenshot up here of one, he can prescribe it and have it sent to my house. Two, he can have it prescribed. He can go in and do the prescription and have it shipped to his practice because he wants to visit with me in person, or they want to run a blood panel, or he wants to do a physical inspection, whatever he wants to do. But it can do additional technology things on the back end with regards to publishing the results, the signature, the ICD codes, things like that. So Chris, if you want, I'd love you to talk more and dive into the technical aspects of the portal.
Absolutely. Thanks, Ron. And I think one of the biggest things that you want to be looking for as a business, as an entrepreneur, as a organization that's scaling into this space, is how can you find a solution that's going to be flexible enough to allow you to capitalize on your value that's, ideally very unique to your niche areas of offer. As much as possible, we really encourage our clients to sort of start there and create a foothold. So as you said, Ron, the Gemelli team in particular focus on a specific niche. Most of our clients start with some niche and then they sort of build from there. We've built our platform in a similar fashion. So we really have a solution where we essentially have these, if you want to think of it like this, like components that are made up of Lego blocks, and they're pre-configured and set up components. So one would be this workflow where someone is going through a registration process. And during the registration process, we can, if it makes sense for your business, check for their jurisdiction. So are they in a region where physically, we're allowed to even show them products? Being able to get their consent that they're of a certain age, or they meet certain criteria to look at certain products, and using GUIP lookup, et cetera. Then once they get to the product, asking them questions and interacting with them if and when it makes sense. So there's sort of a wizard type of an experience for them to go through to make sure that this is the right product for them. Similarly, when they're interacting, once something has been added to their cart or is in checkout, making it a interactive process. For a lot of these scenarios, for someone to actually receive the care that they're intending to get from interacting with your site, they're going to need to actually get a physical prescription. They may have to do a video, phone, or other form of interaction with a provider. And then we will have to legally go through and make sure that the right documents are in place that follow all of the details that are necessary for each jurisdiction. And so all of these pieces are, in our eyes, sort of components that we bring to the table whenever we're working with a client, going through their discovery and their architecture, if you will. Think of it like architecting a custom home. We've already built so many of these. We know what a typical starting place for a kitchen should be, what a typical starting place should be for a master bedroom. But then we can customize every detail of it for your specific scenario. So that's really what I would encourage you to sort of see this as, is what components does your, the way I would say it, headless pharmacy and online, pharmacy platform, and really online, provider platform handle. And in a lot of cases, there's sort of multifaceted aspects of this, where you have a patient portal mixed with a pharmacy, mixed with eCommerce, and all of these pieces have to play well together. So fundamentally, this tends to involve, HIPAA chat So there's some form of chat and messaging that's secure, some form of e-signature so that the providers can actually sign off on prescriptions, and then the patient can sign off. There typically has to be some form of video or telehealth interaction that occurs, and that needs to
So
be,
scheduling.
yeah, exactly. And scheduling appointments for that, being able to manage the messaging, because a lot of people are so busy, including the providers, that they're going to miss if that doesn't happen. And then just generally having an interface where both parties, both the provider and the possibly a pharmacist, and then also the patient, and maybe someone who's helping the patient, they can securely access what the status is of this particular instance of care, if you will, what the status is, and then drill down into the details. And so all of this fundamentally needs to be a really sort of base level of functionality. And then everything else from there is customizable. And so without going into a lot more detail, that's really what we look to provide. The only other thing that I would note is that generally speaking, there are going to be cases where you'll want to, at least for the short to mid timeline for your business, you may want to leverage a SaaS solution or an external third party solution that's very specifically optimized for one part of your solution that you would want us to plug in and integrate with. This is also something to be really cognizant of. How well does your headless pharmacy or headless, patient portal interact with third-party platforms and third-party services? Was it really architected to play nicely with those? And so that's really the intent. And it makes these projects really fun, Ron, because we work with clients who have a vision to provide care, typically at some level of scale that's going to make a difference. I mean, this is literally very direct. It's not like a typical business scenario where it's an indirect, secondary, tertiary impact on somebody's life. This is almost immediate gratification in most cases, that we get to help you execute on your vision, and deliver this quality of care right away. So it's really exciting and really fulfilling to get to do.
Yeah. Appreciate that. Yeah, there's two little areas that I want to touch base that you covered so many different areas, but there's two really important ones that I want to dive into. The first one is very first up front. So one of the online pharmacy capabilities that we have is, you called it just a wizard up front, right? Mm-hmm. But I don't think they appreciate really what that wizard is. So for example, one of the online pharmacy companies that we did, they do ED, right? Mm-hmm. So I'm just going to take Viagra. Since we're guys here, we can talk about that and pick on ourselves, right? So let's say I go to the site and I'm going to order Viagra. As soon as I click on Viagra and add it to my cart, right? So I can go in and say, I want 20, 40, or 60 milligram. I want, 2 a month, 10 a month, 100 a month, whatever. I pick my number. And then I want 1 month, 2 month, or 3 month refill, right? I think there's 3 different choices. I'll pop a screenshot up here on the screen showing the 3 different choices that I can pick. Then when I go to add to cart or click on get started, it'll pop up and say, and I'll also put this on the screen here, okay, you're trying to order Viagra, Ron. We need to know, and this is the prescriber, before we assign this to a prescriber to approve, we need to know a few things about you. How old are you? Are you healthy for sex? What's your blood pressure? What's your height? What's your weight? What's your age, right? There might be some generic medical questions that every single doctor would want to know before prescribing a medication that raises your blood pressure, right, which is what Viagra does, right? And so there would be some very important questions about my height, my weight, my blood pressure. Am I on any medications for blood pressure? Am I at risk for high blood pressure? Things like that, right? Just basic things that every doctor would ask me. So our platform, when you go in and pick the drug, will automatically or can automatically ask the appropriate medical questions for that specific medication that will then be attached to that prescription request as it goes to the provider. So the provider can look at that information, see, here's Ron, age 105. He's asking for 700 Viagra. Holy cow, he's going to go through the medical questionnaire and go, okay, maybe he will, and he can approve. Or he can say, Not so sure, but instead of chopping it down to half strength, let me schedule and request a telehealth session. So it's a very interactive, as Chris used the term wizard, it's a very interactive experience, which allows the providers that level of care that he's talking about. On the back end, I just wanted to touch base on that front end and kind of really explain what that quote unquote wizard is. On the back end, let's say, for example, on the front end, I'm ordering a kit like a COVID antigen test kit. And so I order that kit on the front end, it gets sent in the back end, and then I register the kit online. Now, on the back end, Chris talked briefly about making sure that your headless pharmacy or your platform can integrate or interact well with others. That could be the FDA database, so that when a doctor goes in and prescribes naproxen, they can already go in and see that Ron's already on Oxy, or vice versa, right? So it might be third-party database of medications, so we can see if there's any conflicts. It might be to Medicare, Medicaid. It might be to an EMR, so we can check a patient's copay, what their copay is, and charge them the right amount of money in the portal. It could be to a lab. It could be to the pharmacy. So when the doctor goes in and prescribes and approves the medication, the integration automatically sends the script over to the pharmacy or over to your platform. If you're the one that actually made the skin cream, once the order gets placed, where does that order go for fulfillment? Things like that, right? Once it gets forwarded over to the lab, like the antigen, the COVID antigen test one that I just said, then because we're integrated with the lab and the test got sent to the lab, because we also, as the patient, registered our kit, that registration goes to the lab. So then when the lab in the mail gets kit number 1234, runs the test, gets the results, and goes to post it back, when they post it back for 1234, it automatically gets back assigned to Ron. A notification goes out to Ron and says, hey, your lab results are back. Please log into the portal to check your results. And then Ron could log into the lab, see the results. I'll pop a screenshot up here. And now in a HIPAA compliant manner, I can see my results. And then one last thing, and we've done this on another video, but I'll just touch base on it. Then the portal can have a privacy button. And here's the screenshot of that, where I can go in and go, now that I've bought something from them, I don't want them spamming me, trying to sell me everything every month. So I want to remove my personal data and get my data de-identified. So I just wanted to dive into a couple of those, the one on the front end and then the one on the back end, posting the results back to the portal, which is very helpful. On the back end, also posting back as I go to these portals and order my medications. It keeps track of my refill counter. Here's a screenshot. And once I am 2 weeks away from my medication being out, a refill request button pops up and I can automatically request a refill. And then whether that refill, did the doctor approve a 90-day supply, or does that request after 30 days, because the drug is so strong, have to go back to the doctor for another evaluation and they want to do another question. I know my daughter was on a few medications when she was a teenager that required monthly check-in with the doctor before she could get a refill of that medication. So anyway, I just wanted to touch base on a couple of those. I'm going to turn it over to you to close things out. Chris, is there any last few things you want to talk about?
I think those are excellent points. And that's really one of the hallmarks of our approach to working with clients is we're bringing a single tenancy SaaS model. They can also be deployed on-prem if needed. So you have options, but ultimately it's highly customizable with an opinionated starting place. So you're not starting from scratch. You're benefiting from, past experience that we've accumulated into a very turnkey solution for most of the key interactions and processes that you'll need to execute on. A lot of depth of experience with different integrations. And ultimately, this is what we really recommend. Whatever solution you go for, you sort of compare apples to apples and look for something that has all of those sort of aspects to it, where you can get something that's very turnkey, but then you can customize it as you scale. And I think that's really one of the key aspects that we see over and over is how can we continue to scale with a client? And a lot of times that's interacting very directly with the team and executing on progressions of automation, making it so that the patients can have even more self-service, and just generally making it such that the friction continually reduces over time as we continue to scale the platform, and the standard of service continually improves. So those are some of the key fundamentals that drive that, are all of the areas that you just hit on. So if folks have questions about this or would like us to cover more of any of the aspects in more detail, we would love to see comments or questions in the chat or in the comments section below. And really, other than that, you're welcome to reach out to us for complimentary discovery or just complimentary feedback on your particular business model. If you're in this space and you want to dialogue with a company that's done this many, many, many times, we're always happy to chat and share our thoughts with you. With that said, thanks for watching this video. We'll look forward to seeing you in the next one. Thanks for watching, and bye for now.
Bye for now.